Which of the following is most likely cardiac anomaly associated with the infant's condition? All right. A 34-year-old woman gives birth to a baby with a weak cry, low set ears, clenched hands, and overlapping fingers. The baby also exhibits a small jaw, short neck, and shield-shaped chest. Chromosomal analysis of the infant reveals a presence of an extra chromosome on 18. Okay. 18, I can't remember if that's like patau or one of those other odd ones that isn't trisomy 21. I'm not sure. Let's see. Clenched hands, overlap fingers. ASD, coarctation, tetralogy of flow, transposition, VSD. There's something here that I should know with like 18, low set ears, overlapping fingers, short neck. I don't know what this would be. I'm thinking transposition because this seems pretty drastic, but I'm not too sure.
Okay, final answer.
Yeah, I think so. I'm really not sure.
So I'm gonna just talk to you about here. So make sure you know 13, 18, 21. They'll always
Okay.
ask you like, your names, right? So 18 is Edwards.
Oh,
So
Edwards.
8
Okay.
and E, right? 18
Okay.
Edwards. That's how I remember. 18 is Edwards, 13 is Patel. 21 is Down syndrome, of course. Everyone
Okay.
remembers Down syndrome because it's
Yep.
the most common. Just know that 18 and 13, Patel and Edwards, their life expectancy you think is short or long?
Short.
Short, right? Very, very short,
Hmm.
right? These
Hmm.
kids usually don't live past 1 or 2, right? Because
Hmm.
the more rare a disease is, the more devastating it is. Just remember that,
Sure.
right? And so, also, if we learn a lot about it, right? So, for instance, Down syndrome 21, right? The reason why we learn so much about it is because there's a lot of kids that live a long, long time on Down syndrome, right? And so
Yes.
we don't remember 13, 18 is because they're super rare. Kids don't live very long, right? And so
Okay.
that's number one. How 18 is starts with a E and then E for
Edwards. Okay.
Edwards, and then
Okay.
Patal's 13. Okay, so the next thing I want you to remember is anytime that you're dealing with a syndromic kid, okay, just remember the most common heart or cardiac defect that deals with syndromic pediatric kids is VSD. The most,
Okay.
right? So it's
Okay.
almost a safe bet because it's hard to remember everything, right? Like memorize every
Yeah, I
little.
always get these. I always get these confused. Like I
Yeah.
jumble them a lot.
Yeah, just remember VSD is the most common. So if when in doubt, that's a good answer to pick with an association with the
Okay.
syndrome. Okay, so
Okay.
yeah, that's the best that I'll say. I'm trying to remember anything else, but yeah, those are going to be your key
There's
points.
one with, yeah, is there one with Pato, and then is there one specifically with Downs? I think so.
I think so, but I can't remember. But like I said, VSD is pretty. It's gonna cover anything that like it's. I think it's the most common heart defect in general too is VSD.
Okay.
Yeah,
Okay.
so it's always a safe bet on a test to pick it.
Okay.